What I always tell folks is you need to be able to establish a relationship with your surgeon and somebody that you trust to do the job correctly. And that ultimately takes the most importance, I think, for anything. We have such tremendous expertise here at WashU in the Midwest. There's really no problem that can't be addressed by the technology and the expertise that we have. And that was one of the main reasons why I wanted to join the department, is because of the national reputation that it has in being able to take great care of patients. And not only great technical care, but very compassionate care as well. It's, I think, a department composed of very, not only experts, but great people and great colleagues and folks who I would want to be my physicians. And I think I couldn't have a higher compliment than that. The first and most important part of any discussion about brain tumors has to be compassion. That's sort of my starting point where I come from. I got into this business because I had a family member that had a brain tumor, and the surgeon that treated my family member showed the utmost compassion, and that was very inspiring to me. And so I think that part of the diagnosis starts with sitting down with the patient, understanding what they're facing, what they're going through. I personally like to review the imaging and the other data that led to this diagnosis, and then try to outline for them what the near future might look like in terms of other procedures to be expected, what other sort of doctors might they expect to meet, what other kind of testing might they expect to have, and try to preview a little bit for them of what that may be like. And then, I think a very important part of this is talking to them and understanding what exactly are they concerned about, what are they worried about, try to address those issues head on and give them the answers that they're looking for. The most important part of cancer care right now is that it's a team sport. And it didn't used to always be that way, but with the complexities that are involved in treating any kind of cancer, including brain tumors, it has to be a team discussion. That is, I think, one of the strengths of Siteman, that we can talk to patients about all the different options that are in front of them because we have all those different options available. We have everything from clinical trials to the latest and greatest technology, whether it be inside or outside of the operating room, to maybe sometimes even experts that know more about a particular subject than I do and the latest treatments that might be available for that. Sometimes surgery is the best option, but I always like to tell patients, I promise I will look for a way that's not surgery before we talk about surgery. Protecting the brain's function is of the utmost importance to us. We want to eliminate cancer, but we also want to do it in as safely a way as possible. And we respect, above all, the potential for the brain and the potential for what issues with the brain can cause for patients. And so all of our new technologies, all of our new techniques have been geared towards trying to reduce the risk and the possibility of any sort of dysfunction of the brain. So for instance, we're able to do brain surgery now on patients who are awake in a lot of cases. That worries patients a lot, but we can do it in a way that minimizes pain and discomfort. And what that allows us to do is make sure we're not harming any of the brain's essential functions while we're doing our work in taking out tumors or otherwise treating patients. We have advanced imaging methods that allow us to know how a tumor might be affecting somebody's function or how it might impact any surgery that we might do. In particular, in some of the work that I do with skull-based surgery and pituitary surgery, those techniques are becoming much more minimally invasive. We're using a lot of endoscopes or other sort of technology that allows us to make incisions very small and treat patients in a way that is equivalent to the way we used to do things with larger incisions and larger openings. So in general, the field is becoming more precise, more minimally invasive, and I think safer for patients. And of course, as a surgeon, we also have to be aware of the tremendous advancements that are happening in medical oncology. So the explosion of medical treatments that are enabling us to treat patients who otherwise might need surgery in the past, maybe they don't need surgery going forward in the future. And so the benefit of being part of something like Siteman is that we can have access to those therapies and to the expertise surrounding those therapies, and we can understand who might be a candidate for them. It is essential that we take our care to where our patients are. I think it's great that we at Siteman have such availability of experts in the field, of research, of clinical trials, but if it's difficult for patients to access those things, then it's sort of a moot point. So I think we're making a great effort to try to take our expertise into the community to meet patients at some of the smaller hospitals within BJC or other areas within St. Louis and the metro area to try to show patients that we're here for you, that by seeing us here, we can get your care established, established, perhaps get surgery done at a place that is more accessible for you or easier for you and your family to deal with. I also think that by taking our expertise in the community, we can help to educate folks in the community about the work that we do and how important it is to find a cancer team in the treatment of any sort of cancer. We don't want folks to feel like they're all alone, and by taking ourselves out in the community, we can help to reduce that feeling, I think. The most rewarding part of being a neurosurgeon is that we can have a very tangible effect on somebody's life really right away. You take a patient that has a problem, a symptom, you can take them to surgery and you can see the results of your work pretty soon after what you've done. There's not much more rewarding than that. The other aspect of, I think, oncology care, cancer care that I have really come to appreciate, that I don't think I had a great appreciation for before I started this journey, was the multidisciplinary nature of it. And the fact that you have multiple very intelligent experts working on the same problem, attacking it from different angles to achieve the best outcome for the patient, I think is extremely personally, intellectually rewarding. Not only that, I'm convinced that that is the way to get the best care for people, and I wouldn't do it any other way.